Panel of judges will ask the questions to the presenters.
This session will be chaired by Dr. Raman Gangakheder, who is the former head Division of Epidemiology and Communicable Diseases, Indian Council of Medical Research, New Delhi, and co-chairperson Dr. Sandeep Salvi, Distinguished Research Professor, Symbiosis International University, and jury members Dr. Pramod Mishra, head of the department SIHS, followed by another jury member Kavita Menon, Professor, Nutritionist and SIHS. The following candidates are participating in paper presentation with their respective topics. Now, I like to call upon the first candidate, Danya R. They are presenting the topic, effectiveness of nesting in biophysical parameters and sucking response of low birth weight babies in selected hospitals of Pune city.
Good afternoon to all. I am Dhanya R, second year MSc Nursing student from SCON, and I am here to present my research topic. And this is the abstract of my study. We will directly go to the title and objectives of my study. My study title is The Effectiveness of Nesting in Biophysical Parameters and Sucking Response of Low Birth Weight Babies. And the objectives which I selected for my study is to assess the effectiveness, to assess the biophysical parameters and sucking response in low birth weight babies, and to check the effectiveness of biophysical parameters and sucking response in experimental group, and then to assess or compare the effectiveness of nesting between the controlled group and the experimental group, and finally to associate the findings with the selected demographic variables. So these are the objectives of my study. And the introduction. So I will explain the first, nesting, what it means. Nesting is actually a comfortable measurement that we will provide to the low birth weight babies, that it will help them to reduce the stress in the external environment and also help them to feel a womb-like environment by themselves. And the research methodology, I used this formula for selecting my sample size, and I got the sample size 56, but I calculated the dropouts also, so I took the round figure 60 as my sample size. In that, 30 I took as the control group and 30 as the experimental group. Then the research methodology which I used is, the approach I chosen is quantitative, and the research design is non-equivalent pre-test post-test design. The setting I selected is hospitals in Pune in PMC. And then the population is low birth weight babies. In that, the target population is low birth weight babies in neonatal ICU. And the accessible population is the low birth weight babies in neonatal ICU during the time of my data collection. And the sample is the low birth weight babies. The birth weight should be between 1.5 to 2.4 kilograms. And the sample technique I chose, the purposive sampling technique. The total sample size is 60. And my study design. I did my study through this format. In that, the study setup I already explained, the PMC hospitals, and the population is low birth weight babies whose birth weight between 1.5 to 2.4 kg, and also they should be in 1 to 7 days of age group. And the sample size is 60. Sampling technique is purposive sampling. The criteria I used in inclusion and exclusion criteria I followed. In inclusion criteria I used the low birth weight babies within 1 to 7 days of age group, and those does not have any serious medical illness and does not having any birth problems, congenital problems, and also the birth weight should be between 1.45 to 2.4 kg. The exclusive criteria are also who is having birth abnormalities and the babies who is on CPAP or on ventilators and who is having the serious medical issues. And in this, the selection of samples by the purposive sampling technique, and in pre-test. And in pre-test, I assessed the biophysical and sucking response and I provided nesting as the intervention. And the post-nest, I again assessed this dependent variables in the experimental group. And the results I got, the first one was to check the effectiveness of nesting in experimental group. I used a paired t-test method and I got all the values less than, the p-values less than 0.05. That means my test was my intervention was effective. And the second one was to compare the biophysical parameters and sucking response between the control group and experimental group. In this I used a 2 t-test method and I got all the values, all the p-values less than 0.05. That means my intervention is effective. And the third one was to associate the findings. In that only 3 points is associated, was showing the association with the demographic variables and the remaining all are rejected. So the recommendation of my study is we can apply it in a larger population and in another rural or another setup also, and can do a comparison between another techniques. So thank you.
This is a case control design.
Yes.
Now we know if I am going to compare 1.5 kg baby with a control, let's say 2.2, 2.3 kg.
Yes.
My responses, outcomes should be different. So one thing which I would say is the study, the way you have done is fine. But if you want more accuracy in terms of outcomes, you what to do was 1.5 to let's say 1.8 or whatever. As one group, you would have seen control population
Yes, sir.
of the same group.
Yes.
And the second thing is that we understand you said first, second, and third day.
Yes, sir.
It also connotes to you when should you assess. Even the date of assessment, date of assessment should be same. That's true.
Yes, sir.
Third thing which is also important is you said your sample size calculation was 59 and in order to look at attrition you added 1.
I didn't get, sir.
Attrition.
Okay, sir.
You said from 59 you took it to 60 because some may be lost to.
Yes, sir.
Right?
Yes.
Now when you do that, you must learn the formula.
Yes.
We will give you a higher number.
Okay, sir. Thank you, sir. Thank you, sir. Yes.
I give you another example. What will happen is you said sucking response. As the weight varies, it is also related to the age of the child, gestational age also.
Yes,
so
sir.
the sucking response will also vary. That's why you need a tight control.
Yes, sir. I chosen the gestational age group between 34 to 37 weeks. Okay, sir. Okay.
Gestational age, but then when you do 34 to 37, you
Yes.
must know the sucking responses, they improve gradually in the rate.
Yes, sir.
So, you need tight control. Tight control is choose the birth rate in such a manner or choose the gestational age in such a manner
Yes.
that there will not be differences just because of an error with what you are actually comparing as of now.
Okay, sir.
You could repeat the same. It will become a good practice.
Okay. Thank you, sir.
Very put together presentation by Dhanya. There's a small instructions for the presenter. If there is one bell, then only 1 minute is left for presenting the presentation. And if there is two bells, then you have to stop your presentation because time is up. Next in line, we have Kanchan Adhikari, who is presenting on the topic the effect of Lamaze breathing and relaxation of labor pain and in labor outcome of parch-nourished mothers in selected of Pune city.
Good afternoon, everyone. I am Ms. Kanchan Adhikari, MSc second year student from SCON. So, here my abstract. So, going to the title and objectives. So, my title is Effectiveness of Lamaze Breathing and Relaxation Technique on Labor Pain and Outcome of Labor among Primary Parturient Women of Pune City. Objectives of the study is to assess the level of pain during first stage of labor among primary parturient women. Second is to assess the effectiveness of Lamaze breathing relaxation technique on labor pain during labor. Third is to assess the effectiveness of Lamaze breathing pattern on outcome of labor. Now the introduction. So when the woman is delivering, she is not just delivering a baby. She is also giving birth to a parent as well. So what happens it happens mainly with the primary mother, that they are very scared because they are not informed and educated about the first stage of labor. By this what I mean, that first stage is comprised of first stage of labor is comprised of two phases, that is active and latent phase. So what happens during the first latent phase, only the women, once they start having the pain and contraction, they start giving bearing down efforts. So, to educate and enhance the outcome of labor, a good outcome of labor, the Lamaze is a philosophy to give a fruitful outcome for the labor. Now the research methodology. So the approach was quantitative research, the design was post-test control group, setting selected Pune Municipal Corporation Hospital, population is primary parturient women, sample parturient women who is the first stage of labor, age 18 to 35 years above, and sampling technique were used, purposive sampling technique, and sample size 50, out of which I have divided 25 control group and 25 as my experimental group. So the formula I have used, and the sample size I have taken 50. Now, my inclusion and exclusion criteria. So the women who are in the first stage of labor, as I have mentioned earlier, women who were all the primary at term, then women who were able to understand Hindi, Marathi and English, and exclusion criteria was women with the complications. So, for the experimental group, I have given intervention, Lamaze breathing technique and relaxation. The Lamaze has three components. So, in the first, they have to do the organized breathing. Organized breathing, it starts from the inhalation from the nose and then they have to take a 5-second pause and they have to release it. So, this organized breathing, they have to do it in the latent phase. But when the active phase, when the contraction and the pain starts, they have to do the shallow and rapid breathing, that from the mouth and inhalation from the mouth and exhalation. Then in the when the duration of the when the intensity of pain and the contraction increases, then they have to do the deep inhalation with the exhalation as well as the bearing down efforts. So after giving the Lamaze for 10 minutes, post-test immediately were conducted for the experimental group. And for the control group, what I have did, I have not given any intervention, but only the hospital, whatever the hospital policies, according to that, the care is given. So, the labor pain I have assessed with the visual analog scale, which the scale comprises of 0 to 10 facial expression components. Then outcome of labor, I have included bearing down efforts, duration of labor, mode of the delivery and expulsion of time. Then according to my demographic, obstetric variables were included: gestational age, antenatal checkups, phase of labor and true onset of labor pain. Then objective one result is assessment of the level of pain during first stage of labor. So in the experimental group, the 72% women were having the moderate pain, whereas in the control group, the 44% were having the moderate pain. Then result continues the comparison, the effectiveness of Lamaze breathing pattern. The p-value is less than 0.05. So the null for me, for my study, the null hypothesis got rejected. Then the effectiveness of Lamaze breathing and relaxation technique on the outcome of labor. So in this, only the significance is more. Can I have 1 minute, please? Okay. All right. I'll just conclude. So what happens, because the primary mothers are mainly, they are not educated about the labor birthing process. So what happens, they are very scared, and because of that they are not being taught about the bearing down efforts when they should do it. So what happens, they are already exhausted in the latent phase only. So when the actual demand of bearing down efforts is required, the mother is already exhausted and they demand for C-section. So I have for this my study results state that the Lamaze breathing is having a significant role in the pain assessment as well as in the normal duration, the normal labor duration. That's it. The recommendation is comparative study can be among two different techniques. The other complementary or alternative therapies we can use. Then a similar study can be done in a different setting, could be considered at a rural setting. A similar study can be replicated on a large sample because I have taken only 50 samples. And a comparative study can be conducted among the primary mother and the multi-mother. Thank you.
Few quick points. First thing is, people can question, where you know there is a benefit that is associated with the this thing. Why is it that you have not provided the same to the control population also? Because ethically, you are not justified in doing such an experiment. So you could have done it little differently.
Okay.
That's all. Second thing which is important is you use VAS, visual analog scale,
Yes.
for measuring pain. And what you have done is you have compared it between different mothers.
Yes.
Now, one thing which we have to also remember that the perception of pain has huge individual variation. If you look at even in your profession, you must be remembering when you give injection to a person,
Yes.
somebody would cry out and the others don't. So you could have thought as to which pain scale you would have used or change the design accordingly.
Yes.
Thank you.
Analog scale. Yes. Surely, sir. As a new researcher, I may include in future. That's it, sir. I'm done.
Let me tell you one thing, I am very happy at both the presentations. There is, your efforts are beyond the baseline. It's only that you need to have.
Thank you, sir. Thank you, sir. Thank you.
Thank you, Kanchan Adhikari. It was indeed an enlightening presentation. Next, we have Aarti Chand, who is presenting on the topic, a study to assess the effectiveness of planned teaching program of knowledge of lifestyle modification among the COVID-19 survivors in selected areas of Pune city.
Good afternoon, all respected dignitaries. This is Aarti Chand from Symbiosis College of Nursing. So today I am going to present my paper presentation. So I directly come to my problem statement. My problem statement is a study to assess the effectiveness of planned teaching program on knowledge regarding lifestyle modification in COVID-19 survivors in selected area of Pune city. In selected area of Pune city, I took Pashan because I have posting, so I take advantage. I have 60 samples from Pashan. My objectives are to assess the pre-test knowledge, to assess the post-test knowledge, then association between or the effectiveness of the pre-test knowledge and post-test knowledge, and last one is the association between pre-test knowledge and demographic variables. So now come to the introduction. So in introduction part, we all know that COVID-19 is very dangerous, or it not only affect our health, it also affects our lifestyle. During quarantine period, we all know that our lifestyle totally changed. So I took this research because I seen in lifestyle, so I took this research about lifestyle modification, in particularly COVID-19 survivors. So now come to the methodology section. So in the methodology section, I took the setting is Pashan, sample size is 60, age group is 18 to 48 above, and then firstly I selected only COVID-19 survivors. Then I assessed the pre-test knowledge and I did my post-test knowledge, and between this I gave my intervention as a planned teaching program, and I got results. So in pre-test, as you can see my slide, the frequency poor is 24, average is 27, and good is 9. But after giving my intervention, you can see that they improve their knowledge. So the poor is 2, average is 27, and good knowledge is 34. I said only frequency. As you can see, I mentioned percentage also, and my graphs also shown you. And now come to the effectiveness. The mean value of pre-test or mode is 11.15, then 3.96, and post-test is 17.26. So as you can see that after giving intervention, post-test knowledge is increased. Now come to the association pre-test or demographic variables. So this is, I use the chi-square formula, so I got the p-values. So in this only qualification value is 0.005. So only in this my H1 hypothesis is rejected. And then come to the discussion part. The perspective of this study is to assess their knowledge and to see that after COVID-19 what the lifestyle modification they are following. So this is the reference, and thank you so much. This is the picture when I give my planned teaching program. Thank you so much, ma'am. Thank you so much, sir.
One small suggestion. You had a good topic to work on.
Yes, sir.
Actually, you could have done both. No, those who were COVID survivors and those who did not have COVID, they were in their own households, and how things are done. But that is a different kind of a question. So one of the major limitations of this study is you have assessed pre and post intervention.
Yes, sir.
Now, if you do it on the same day after taking, it will not be considered as valid, because anything that you teach me right now, you will be able to repeat that when you will ask again the same question. So there has to be some sufficient period, that's one, to measure knowledge. But only measuring knowledge is also not a complete assessment, because knowledge must translate into practice.
Yes.
So one has to also measure, did the person change
Thank you, sir.
So, giving a very good feedback, actually, even while I listening to those things were coming in mind, I can give her a different suggestion where she can improve the study further. Always, the pre-test and the post-test are actually no good, that's also said. And also, if you repeat after some time, okay, you can have an immediate reaction and a late reaction, okay. But if you take a questionnaire on how they took your intervention and how it helped them, if you have certain questions such as open-ended questions and then you are able to pick up those questions and then come up with the result, that can also add up to your study. So basically, when we are doing an intervention which is knowledge based, we should also take a questionnaire on how it was done. That is what we take as an educational setup or an educational study. So you can have a questionnaire how they went about, what they felt, what was their experiences, something like that. If you take as a questionnaire from them now also, it can add up to your study.
Ma'am, when I did my pre-test, then between I give intervention as a plant teaching program. So in this, I give health education. I educated them.
I'm saying how this is something of your knowledge, how it, your intervention they took it as not only knowledge based, but how it went to them, how it helped them. So something like that can also give you an additional data for your public.
Yeah, ma'am, I can understand. Thank you so much, sir, giving this opportunity, and thank you so much for your feedback. I am new in research, so in future I will be adding all your feedback. Thank you so much, sir.
It's very nice. This is, I tell you one thing. This is not a criticism, this is nothing, The expectations from nursing students to do quality research, actually, they have very few journals to read. So the direct impact is hardly ever seen. But what I'm actually gauging now is perhaps you have a better ability to conduct this research. Take these suggestions positively and all the nursing students, and they should try to improve. You will make a name for your own institution.
Thank you so much, sir.
Thank you, Aarti, for bringing the light on the topic. Next, we have Ayushi Singh, who is presenting on the topic Effectiveness of Video Assisting Teaching on Knowledge Regarding Self-Body Scan Medication Among School Teachers in Pune City.
Good afternoon, one and all. Myself, Ayushi Singh. I am a student of Symbiosis College of Nursing. I am pursuing my master's in mental health nursing. I am here to give my research paper presentation. So this is the abstract of my study. And this is the title of my study, a study to assess the effectiveness of video-assisted teaching on knowledge regarding self-body scan meditation among school teachers in Pune city. So the objective of my study was to assess the pre-intervention knowledge regarding body scan meditation, to assess the effectiveness of video-assisted teaching on knowledge regarding body scan meditation among school teachers, and the last objective is to determine the association between pre-intervention knowledge regarding body scan meditation with selected demographic variables. So introduction. Body scan meditation is basically a mindfulness stress-based reduction technique in which we are giving education or we are giving knowledge like how they can feel the sensation. Like it is a meditation technique, and we ask the patient or we ask the people to meditate and feel the sensations in the body which is barely noticed by them. Means when we are so much indulged in certain kind of occupation or work, we certainly unnotice some kind of sensation or discomfort which are there in our body. But with the help of this type of meditation process, we'll be able to focus on ourselves, we'll be able to connect ourselves with our physical health, and we'll be able to find out the sensation, the discomfort, or we can say any kind of pain which is there inside our body, but we are not able to identify it. My research methodology, research approach I choose, quantitative research approach. Research design is pre-experimental research design. Setting is selected pre-primary and primary schools. Populations is teacher, target population school teachers, and accessible population school teachers living in Pune city or those who are available at the time of study. My sample is school teachers. Sampling technique is convenient sampling technique, and sample size is 100. So I have divided my result in 3 sections. First section will tell you about the knowledge regarding pre-intervention knowledge regarding the body scan meditation among school teachers. So I have given them a questionnaire in which they scored, means 73% of the population has poor score and 27% were having average score. Then section 2 is to assess the effectiveness of video assisted teaching on knowledge regarding body scan meditation. After giving video assisted intervention, their knowledge is improved. So the average score was 28%, from 27% to 8%, and good knowledge score is changed to 92%. So my result shows that there is a significant improvement in knowledge among the school teachers after giving video assisted teaching. This is a analysis of association between demographic variables and pre-intervention knowledge. So I didn't found any association between demographic variables and this pre-intervention knowledge. So, then recommendation, I am going to do another study on practice session. I'll take practice session and assess that. And a similar study can be done among school teachers as a comparative study between school teachers and college teachers, and it can be replicated on large number of population. Thank you, sir.
Quick suggestion.
Yes, sir.
Perhaps whatever I told you earlier, before and after the experiment,
Yes, sir.
the limitation continues to be here.
Yes, sir.
So you're essentially looking at either knowledge or attitude.
Yes, sir.
So that limitation will always be there. The class intervals that you have used, 3.1 or some such thing. If you show the last slide, the last paper. Yeah.
Sir.
Now, one needs to keep in mind as to why do I want these class intervals like this. It is not only 5 years difference, because here you are trying to assess beyond. No?
Yes, sir.
So, whoever use whatever you want. Because I generally never get it should be 25 to 29 and 30 to 34.
Okay,
Not
sir.
the other way. 30.1.
Okay, sir.
You can see that in the results. That's two. Number 3, I would say, you should look at the number of variables that you are going to use for analysis. You look at marital status. It has 4 variables, right? But when you actually look at it, the numbers are too small in each of the cells.
Yes, sir.
You could have a club, divorced and widowed together.
Okay, sir.
It doesn't matter, because that is not going to influence your outcome. One should pay attention to those issues. You could club different variables as much as you can.
Okay, sir.
Thank you.
Thank you so much, sir, for your valuable suggestion.
I will tell you the other way. You look at some of the variables. No, this is only for learning, for everybody. No? If you have 0 as a number, like you have a diploma,
Yes, sir.
now that adds complexities for analysis. Many a times you will find there would be
Okay, sir.
So you should have sufficient numbers in cells.
Okay, sir.
That's why one needs to plug them as much as one can.
My initial would be, if you're going for convenience sampling, you will have more number of samples. Because it is convenience sampling. That's why you should, 100 is quite a low number.
Okay, sir. Thank you, sir. Thank you all.
Thank you, Ayushi Singh, for a lovely presentation. Now we have final presenter whose name is Dr. Rohan Shah, who is going to present on the topic Effect of Cleaner Cooking Fuel on Cardiopulmonary Health in Women from Rural Maharashtra.
Good evening, all. Hello, sir. So, other than SYMHEALTH first day, what is the date today? 22nd April. So, yeah, it's Earth Day. So, looking at climate change, I don't know to call it a happy Earth Day or a sad Earth Day. But I would choose Happy Earth Day because implication of my study will definitely co-benefit health and environment both. So, I, Rohan Shah, would like to present my topic, Effect of Cleaner Cooking Fuel, LPG, on cardiopulmonary health in women from rural Maharashtra. 7 million deaths take place due to air pollution, and out of that 3.8 million is just contributed to indoor air pollution, that is household air pollution. Mainly all women who cooks inside the household, they are mostly affected. Many of the studies had looked at lung effects or pulmonary effect of this pollution, but very few have seen cardiovascular also. The only solution which I see is to reduce this problem is to give a universal access to cleaner cooking fuel or universal access to cleaner cooking fuel. Pradhan Mantri Ujjwala Yojana, which is started in 2016, given more than 10 crore connections to such deprived household. The scheme is wonderful, a flagship scheme, but health impact was not studied well. So I took my study on basis of that with a primary objective to compare the blood pressure of women of rural Maharashtra who are using either biomass or LPG as their sole cooking fuel, with secondary objective of to compare pulmonary function and blood glucose levels in the same women. Coming to the methodology, it's a cross-sectional design which was done in 3 rural blocks of Pune district, that is Khed, Junnar and Ambegaon, and I have recruited 2 females, that is primary cook who does majority of the cooking, and secondary cook who does cooking in absence of primary cook, and total I have recruited 997 women, that is in primary cook there were 400 in each group, and around 100 I got it in secondary group. I have done questionnaire, anthropometric measurement, blood pressure measurement, glucose measurement and spirometry measurement, and additionally PM 2.5 measurement in these households. Coming to the results of my study, if we see preliminary results, that is if we compare blood pressure between both the groups in primary and secondary cook, there are significantly higher blood pressure levels in biomass group compared to LPG group, similar random blood glucose level also. And if we see prevalence of hypertension, then stage 1 and stage 2 hypertension were also significantly higher in these groups. Looking at lung parameters, if we compare FVC, FEV1 and FEF 2575, then those are also higher in these groups. Sorry. If we see small airway obstruction, obstructive pulmonary disease and restrictive pulmonary disease, the number were quite high in biomass group when we compare between both the groups. I have done spirometry pre and post bronchodilator, and now coming to the result of particulate matter along with the study variables, if we see LPG group household kitchen where I measured PM 2.5 levels, there were 14.7 times lower PM 2.5 concentration compared to the biomass group. And if we see wood and govri, if used together, they were having highest PM 2.5 concentration, that was around 680, right? And looking PM 2.5 concentration and hypertension category, so the people with higher stage 1 and stage 2 hypertension category had higher PM 2.5 concentration in both the groups, biomass and LPG group. If you can see the plots designed in red and blue, so red shows that higher the PM 2.5 values, higher is the blood pressure values. There were no change in blood glucose level when looking at PM 2.5, and in the blue there are pulmonary function tests which are also lower in where there are PM 2.5 is higher. So key highlights from my study. Still study analysis is going on. I'll be doing logistic and linear regression adjusting for confounders, but the numbers days visited to doctors and other symptoms like headache, irritation of eye and etc. were higher in biomass group compared to LPG group. If we see healthcare expenditure, so healthcare expenditure for primary cook was double in biomass group, 3 times in secondary cook. And if we see overall 6 months of family healthcare expenditure, that was 1.5 times higher than biomass group. On average, participants spend 15.9 minutes a day of their time in collecting biomass fuel, which eventually when they shifted to LPG, it came to 8.4. So if 15.9, it is 100 hours in a year. So conclusion, based on preliminary analysis, biomass is significantly associated with increased risk of hypertension and lung function deprivation, and adoption of such cleaner cooking fuel will definitely have meaningful clinical and public health implication. These are some references. Thank you.
This is a nice study.
Thank you, sir.
Yes.
Yes, sir. I got opportunity from Kirk Smith, sir, and Joaquin, sir. Yeah.
But there are a couple of things which I
Yes, please.
One thing is, you should not have diabetes, that is, let's say you have measured glucose,
Yes.
and then you are also using hypertension as a variable.
Yes, sir.
Now, these two are not independent variables. There is an interaction between those two. If you quickly go over some of these slides, very quickly, because I have forgotten many things. Now, one of the things which you have to realize is, when you are talking of particulate matter 2.5, you should mention in your presentation when did you measure this?
Yeah.
Because this also
Yeah.
depends on season.
Yes.
No, it may vary over a period of time, and that affects the outcome.
Yes.
The third issue is, you cannot know when you see particulate matter 2.5 and you are associating it with hypertension. That could be a spurious association.
Yes.
Because that's an incidental finding. You don't know what is cause and effect.
Agree, sir. Yes.
The fourth issue which I realized was you have not defined who were your controls.
Yeah.
If you are comparing, let's say a woman, you took all the women.
Yeah.
No, what was the age? No, you
Yeah.
should have an age matching.
Yeah.
No, what was your criteria is not very clear.
Yes.
No, because you can't compare a woman for the outcomes like hypertension.
Yeah.
You might find that if you are comparing a woman who's postmenopausal,
Yes.
with a woman who is perhaps younger, it would not do the justice.
Yes.
And when you handle women for such chronic morbidity, it's important to fix that time for pre and postmenopausal. Because then the whole picture suddenly changes. And so you may have to try and look at it little bit.
Yes. Can I answer few of the question, please? Yeah. So PM 2.5 was measured 24 hours in a day. Yes, I understand the seasons can be varied definitely, and it will affect the result. We might need to adjust for seasonality. Women, since there was time constraint of 5 minutes, I couldn't put the demographic slide. Age group was not significantly different between both the groups, and both were 44. So that was age group both in biomass and as well as in LPG group. I have recruited LPG group in such way that women who have previously using biomass but switched to LPG with minimum last 1 year and more less than 5 years. So between that period, I have recruited those female to understand the effect of this massive intervention.
So, when you present,
Yes, sir.
you should always have one slide which says,
Yes,
in methodology, what was my definition?
I understand.
How did I do it? What was the period in which I have done it?
Yes.
So that it becomes easy.
Yes, sir.
No more questions.
My apologies, sir. Yes. Thank you so much. Any questions? Sorry, ma'am. Huh. No, ma'am. For biomass group, it was 406, and for LPG, it was 402. Based on sample size calculation, it was came into 393, but I recruited 406 and 402 as a primary cook. So because my majority outcome I am seeing in primary cook, I additionally took secondary cook, which I found around 100 in both the groups. Yeah, sorry. Yeah.
You could also think of one thing in order to improve the chance of publishing it in a book.
Yes, sir.
Since you do not know PM 2.5 and hypertension whether they are cause or effect, so what you should do is you should show additive effect. In terms of if you are saying a woman who has used it for 10 years, I compare the same with some woman who has used it for 15 years and adjust it for age, control it for age in analysis.
Yes.
You will find you will get some additive effect which will help you.
Yes.
If it doesn't come, then it's a spurious association.
Understood, sir. Yes. Taken. Okay. Thank you.
Now, the reason why I did not speak about it, he himself said in his talk that he is continuing to do the analysis. So I thought there was something which he has missed. Actually, if you look at his final conclusion slide and look at what he presented as primary objectives and the entire thing that he has assessed, the conclusions are different than he has described some other things in conclusion. But I thought that was because he has admitted, no? It's an ongoing work.
Now I would like to call upon Dr. Raman Ganga Kedkar sir to say a few words about the paper presentations.
ये तो बेस्ट था मैं पहले बोला नहीं one thing which we have to realize, looking at the kind of presentation that you have, perhaps they have a good opportunity if they improve upon research methodology to actually reach into better journals. The Indian journals in all nursing do not have any impact factors if you actually look at it. But if you do good work, perhaps you will reach into international journals very quickly. So it is, to be very honest, this came as a pleasant surprise. No, I did not imagine that the approach would be so better. Perhaps I had imagined that it will not be going into a very standard way. But I see a big value if you improve the research methodology. I'm sure you will perhaps some of those studies would even go into good journal. And I would always wish all of you very happy career. Even in nursing today, there will not be importance of publication unless you go into teaching. But those days are going to change shortly. You will find that even publications are required for any nursing job because it tells you how you think and how you approach logically. And I'm sure you will make a difference. And I wish you a great success because if you do well, even publish few papers in international journal, the SWAN, they say, no? SWAN will have a big value. And I wish you success in that.
Thank you, sir, for your kind words. Now I'd like to call upon Dr. Girija Mahale to take over the session.